Hi, my name is Natasha Kimsey, and I'm a wife and mother of two boys, ages 10 and 12. I've worked in public health for 17 years, and as we've all experienced, the last two have been like none other. In public health, we plan for pandemics and role-play emergencies as part of our jobs. I'm also very knowledgeable about routine and booster immunizations. I'm even a vaccine supporter of vaccines for adults and children. When I started to hear about the COVID-19 mRNA vaccines like Pfizer and Moderna, I started doing my research. I talked to anyone who knew more about these vaccines than me and listened to the experts. I had the same fears many women of childbearing age have. How will the mRNA vaccine impact my long-term health? And will this affect my ability to have children? I became infected with COVID-19 in October 2020, before the vaccines were made available. After about a week with no symptoms, they started to show up. I developed a cough, had sore throat, congestion, shortness of breath, and extreme fatigue. I actually ended up in urgent care one day because I couldn't talk, breathe, or swallow a bite of food. Fortunately, I was able to recover with an inhaler and some meds, but the fatigue ruined my life for the next 6 to 8 weeks. I missed 3 weeks of work, but even after that much time to recover, returning to full 10, 12-hour days proved to be too much. I continued my vaccine research and was relieved to read that I could have immunity for at least 90 days post-infection, according to the CDC. Some agencies speculated even longer. Either way, I believed I could continue my research through January. Then it happened. At work, I received a call from a single mom who had questions about giving the Pfizer vaccine to people like her who had severe allergies. This mom of two carried around an EpiPen and had not been out of her house since March of 2020. I answered her questions about the vaccines the best I could, and then she asked the question, "Which vaccine did you get?" At that moment, I realized all of my reasons for putting vaccinations off just weren't good enough any longer. Here I was encouraging another person who is my age and in similar life situation to do it. Before I could say anything else, she said to me, "That's it, we're getting vaccinated together." 3 days later, we met at the vaccine site at Sears, introduced ourselves as new friends, and then got in line to get our vaccines together. We stayed with each other while we got poked and for a 30-minute hold and observation. We texted each other the rest of that week to make sure neither of us had severe allergic reactions, and we stayed in touch through the second dose appointments as well. I bet she'll text me soon about these booster doses. The second dose of vaccines gave me fever and chills that put me in bed for a weekend, and that made my husband hesitant to be vaccinated because he worried that missing work due to the vaccine's potential side effects was just too much. I'm sharing my story with all of you today because I was once nervous and hesitant about getting vaccinated despite working in public health and despite my research. I finally decided to get vaccinated against COVID-19 because I never want to feel so fatigued or sick that I miss out on life again. I know people who've lost their lives to COVID, and while I support everyone's right to make their own choices, including my husband who's starting to lose the reasons to put it off game, I will never choose to miss out on life when a choice can be made to protect it. Thank you for listening.